Now a look at some alarming new research on vitamin and mineral supplements. More than half of all American adults take some kind of daily dietary supplement.
But this new study finds certain supplements may increase an older woman's risk of dying, and that certainly caught our attention. Medical correspondent Dr. Ashton is here with more. That's a tough headline, so let's talk specifically first. Which supplements are we talking about here?
Well, let's break down the study, Erica, and you're right. The headline, like many, can be deceiving. First, we have to mention this study was based on associated findings. It did not show a biologic cause and effect. Very large study done from 1986 to 2004 in Finland. Very large study. They looked at almost 40,000 women, average age 62. That's also important. They found in this group, 85% of them took at least one dietary supplement a day, very similar, as Chris said, to what we do here in this country, found an associated increased risk of death amongst these older women for those in particular taking vitamin B6, folic acid, iron, magnesium, zinc, and copper. So again, didn't say why, but did show that they had an increased risk of dying.
What is it about these supplements, though, that causes that increased risk?
Well, in general, we don't know, Chris. And one well-respected doctor that I work with says he's very skeptical about dietary supplements, not because he thinks they don't work, but precisely because he thinks they do work. And in fact, we don't have enough data. We don't have enough well-constructed research to show us what the effect of these particular vitamins can do, especially when taken in high doses, excessive quantities. In particular, this study showed that iron had an increased risk of death. And we know that for certain people with certain types of blood disorders, excessive iron can be dangerous to the heart and the liver, so that may be one cause.
And I mean, you would know this better than anyone, being an OBGYN, but for women too, I mean, iron is something that you tend to take. A lot of people when they're pregnant, both of my pregnancies, mildly anemic, and then it can continue on. So, so when do you, I know you should always check with your doctor too before taking a supplement, but if you've been taking it for a long time, do you still check in?
Well, that's part of the thing, Erica, is that most women, most patients don't consider these supplements to be like medication, and in fact they should. So there are a couple of tips. Number one, if you are taking anything, especially when you've been taking it for so long, so many years in the past, you really want to discuss these with your doctor. You want to try to avoid self-diagnosis and falling into that trap of the marketing and advertising claims that a lot of these supplements portend. And also, do not assume that more is better. Really, do not take more than the recommended dosage, because we do know that these vitamins, like anything, can be dangerous.
All right, Dr. Ashton, thank you.
You bet.